At the same time, one of the things that we did was we changed our focus from mental illness to mental wellness. So the premise behind that is that if we focus on mental illness all the time, that's what brings the stigma. That's what brings the negativity to having to deal with mental issues or mental concerns. So we're looking at, okay, who's our client? Is it the person that walks through our door? Well, yeah. But is it the entire community? Yes, it's the entire community. If someone is in good mental health, if somebody is balanced in their lives, well, we want to keep you that way. As a mental health department, we want to ensure that if you're happy and you're healthy, we want to make sure we put on programs and services that are going to keep you that way. If you are experiencing issues or concerns, then we want to make sure that our service is welcoming enough that you will come in when you need our help. So we put on everything from sports and recreation programs to cultural and traditional activities. Mm-hmm. We try and very hard to disguise mental wellness work as fun community outreach so that people don't feel stigmatized by talking to a mental health worker. Mm-hmm. Because they're putting on learn to swim, learn to sail, learn to play lacrosse, learn to play hockey. And this is a real list. Valerie? Learn to surf, learn to sail, learn to play hockey, play football, learn to play lacrosse, learn to play. Mm-hmm.
Learn our culture and our traditions mm-hmm. as well. The cultural teachings, cultural camp. We organize a cultural camp every year as well. Mm-hmm. And within the health department, when you know, we also realized that the health department realized and mental health realized, you know, the need for types of programming like parenting programs. I'll give you an example. Often people who are dealing with issues in mental health or distress or family issues or whatever may have an association with Child and Family Services, and it's often mandatory. You know, Child and Family Services say, well, you guys need to take a parenting course, you know, to improve their parenting skills, which have been lost over time. Mm-hmm. And and we tried it. We tried multiple. The government would send us all these programmings, all of these help, you know,
prepackaged programs.
Prepackaged programs for parenting that were developed for the mainstream population. Nobody would show up. Nobody wanted to attend them. Nobody wanted to be labeled as a bad parent, number one, right? You know, you're doing the best you can with what you know, and so with that in mind, we realized that number one, we needed to develop a parenting program that was based on our cultural teachings and understandings. So we did develop a parenting program collaboratively with mental health within the mental health department. As well, we learned within health programming, you know, we want people to come out to learn more about managing their chronic diseases. We want parents to know more about how, you know, immunizations are important for their children, or not to feed your baby solid foods before this time. And so we, as part of that whole process, and learning from the parenting program, they established programs, what's called Mothers Helping Mothers, or Dads Helping Dads. And it's an opportunity for community members, mothers, you know, to come together to socialize, they come to learn. We have an education component at every Mothers Helping Mothers event. And then we also have a fun activity after the educational event. And of course, food and all that kind of stuff too. So it was about, you know,
creating, because of residential schools and all that you've learned about residential schools, some of the fabric of family relationships was broken or interrupted. So what we wanted to do was build on the strengths that were there from the past, but just enhance them, bring them to the forefront, treat everybody with the respect and the truth and the honesty that they deserve. So created all kinds of opportunities for people to come together. At the Mothers Helping Mothers program, there are elders that participate, as well as moms and young moms. The Dads Helping Dads program has begun again, and it's about creating or reviving some of those traditional bonds that had been there in the past but may have been interrupted. So it's about bringing it all back. We've just started a Youth Helping Youth program with the same intention. Build on the strengths, focus on the positive, create that sense of unity, community, and respect and caring for each other. I think some of the other things that, when you look at the way that we implemented our mental health model, for lack of a better word, I'm sure there's another model out there somebody has a much better name for.
No, I like yours.
But we call it the Fishingnet Model of mental health service delivery. And because we're from the East Coast, why not? So the intent with the Fishingnet Model is that the strands of the net are our workers. Out in the community, they're putting on Learn to Sail, Learn to Swim, Learn to Surf, Mothers Helping Mothers. They've got all kinds of, they've got sweats, pipe ceremonies, cultural teachings. They're out there in the community interacting with people. So they see us as humans first, mental health practitioners second. We've created that bond. People are interacting with us. No one knows whether they're interacting with us because they've got a mental health issue or because they really want to know how to play football. So we're out there. We're the strands of the net. There are, in our interactions, through learning how to football or putting on a sweat or pipe ceremonies, there are clients that we scoop up. We know that they need our help. So when invited, we scoop them up. We bring them into our agency. We ensure that they're referred and seen by appropriate personnel in the service. And then taken care of. They know the net is there. Then there's all kinds of fish, as I had said earlier. Mental health and mental wellness is something that you strive for your entire life. So there will be good times. There will be bad times. When the bad times exist, we want people to know they can swim through the holes in the net. For the rest of the population who may never need us, they know the net is there. If they ever need us, we will scoop them up and we'll bring them in. Do we want people, as I said earlier, we want people to come in and out, in and out. We don't limit them, we don't cut them off. I mean, they're part of our family too. I've been in Escazone since 1994. I see children that I saw many moons ago with their own children. And for me, that's a success, to be able to know that I can interact and follow a client from the time they were a child until now they're children. They're bringing the children in to me to say hi. It doesn't have to be a negative thing. It doesn't have to be that their child is experiencing a problem. To me, that's mental health, mental wellness at its absolute best. So I'm sure there's a fancy word for it out there somewhere, but it's the Fishingnet Model of community mental health care.
So our approach is really, you've heard the two-eyed scene several times around, and so we are aware that mental health services are required to several individuals within our community, and that is clinical supports that are needed. But there's also these other supports that are needed, community-based, community development models. And so we are blending Western and traditional approaches to all of the services that we provide within our First Nations community.
So that means our cultural support worker, who is Clark, who you met before, works hand in hand with our clinical therapists, whether they be a social worker or a psychologist. And they're on an equal level. One is not better than the other just because they have an MSW or an MA. You've met Clark. There's not too many MAs or MSWs or that can compete with Clark. His skill set is as someone with an MSW and an MA or a PhD. So it's about working together to get the best outcome for our clients. I think the other part of it is when I talk about, Sharon and I talked about this, it's sort of like going down the rabbit hole. When you talk about some of the changes that we instituted, you kind of get off and branches. But one of the things that we noticed in a lot of mental health systems is that there's a bottleneck. You have to wait for an appointment to be seen by a specialist of some sort or another. So one of the things that we instituted, we have paraprofessionals, we have peer supports, we do have baccalaureate level, master's level staff members. Some people who come through our door do not require the services of a social worker or a psychologist. They are quite fine and quite happy to be seen by a peer support worker or a paraprofessional. And it meets their needs. So they don't have to be referred onward. It's like walking up a ladder. Rather than a bottleneck, you've got appropriate care for people at every stage. So it doesn't, we make use of peer supports, we make use of paraprofessionals, baccalaureate level, and then the master's level. And with one of our new projects, we're looking at instituting psychiatric services so that it's a progression. And only those that need the specialized care walk up the ladder. So that it's not a bottleneck. We provide services. People are referred daily, or people are assigned daily. So that means I could be in Alberta, and my staff will get a hold of me and say, I have a referral. I assign it then and there so that there's no wait. There's no wait times. The longest anybody would probably have to wait is over the weekend to be contacted by a staff member. So 72 hours.
But we still have available 24/7 crisis line for those who are in distress. And the clinical services are available at the local district as well.